Joining me now is Key Liu, President and COO of the International Medical Corps. Key, welcome to the show. I want to start with this breaking news of another earthquake in Venezuela, 5.4 magnitude. Have you heard anything from your colleagues on the ground?
Yes, I mean, the situation at the field level is desperate. Our staff, their families have been impacted. International Medical Corps has had a longstanding mission in Venezuela, and therefore, in the immediate aftermath of the earthquake, our focus was really on the safety and security of our staff and their family members. And we feel really fortunate that they're all safe and accounted for.
What are the most urgent needs your crews are attending to right now as search and rescue missions continue?
So our emergency medical teams are currently in La Guaira, which, as you know, is the most heavily impacted region with 70–80% of buildings that have collapsed, that are damaged. The situation is desperate. We're 48 hours into this earthquake. Search and rescue operations are underway. Unfortunately, there's thousands of people that are still unaccounted for, trapped beneath the rubble. With regard to the health system, this was already, prior to the earthquake, a very weak and poorly sourced system. Our teams, for example, yesterday visited a psychiatric hospital that was heavily damaged, and we're told that almost one half of their patients had died or were trapped beneath the rubble. They visited one of the larger regional field hospitals, the Social Security Hospital. This hospital is running out of supplies. They're running out of medicines. They suffer damage to the infrastructure. They've been forced to carry out surgeries and treat patients in corridors and treat them outside. That increases the likelihood of infections and contamination. So for those health facilities that are functioning, if they're not totally damaged, they're overwhelmed. They're running out of resources, and we expect that there will be more patients in the coming days. And in response to this, International Medical Corps is now deploying mobile medical units. One of the most critical things at this point in time is to be able to support the trauma centers. They're overwhelmed, so being able to treat patients that allows us to triage and to be able to refer the most patients in need to the hospitals will decrease and decongest the hospitals.
Sure.
We're also hearing from patients that they're running out of water. So we're going to be bringing in water. We're going to be bringing in and resupplying medicines to these hospitals to keep them going.
Key, we were reporting that 8 hospitals have been destroyed. You mentioned the obstacles with healthcare. This was before the earthquake. As we're seeing the damage, we've seen the images of Venezuela's largest airport. It sustained so much damage because of these earthquakes. I have no doubt that's creating a major obstacle for rescue teams. Is it difficult to get in and out of the country right now?
So it is a challenge. At this point in time, we've been able to source locally medicines and supplies, but over the coming days, we expect that those resources will dry up. And therefore, there will be a need logistically to be able to open up the main airport. There are some secondary airports that are open. For example, International Medical Corps, at this point in time, we have 2 large field hospitals pre-positioned, one in Panama City, Panama, and one in Memphis in Tennessee. And we plan on deploying those field hospitals. So we are working very closely with the Ministry of Health in order to identify the appropriate sites, to identify the gaps, and to work with the local authorities to bring in these large numbers of pallets in order to be able to scale up our intervention. So we're just at the starting point in terms of this response. And unfortunately, over the coming days, the search and rescue operations will pivot to search and recovery operations. But there will be a large number of patients who need trauma care, and we have to figure out a way in order to keep the hospitals functioning. And the ability to bring in field hospitals will greatly enhance the capacity of the local authorities to be able to provide life-saving assistance.
Well, Key, thank you for everything you and the team are doing on the ground. We're looking at this video. This is absolutely heartbreaking. And like you mentioned, the death toll and the number of injuries are only expected to rise. We will keep an eye on it. Please keep us posted on what's happening on the ground. Kilu, thank you again.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.